Right now, I am very happy to first introduce and then bring on Dr. Zachary McVicker from the Paley Institute. Dr. McVicker is a fellowship-trained sports medicine physician specializing in minimally invasive arthroscopic surgery of the hip, knee, shoulder, and elbow. Dr. McVicker completed a sports medicine fellowship at the world-renowned Cedars-Sinai Kerlan-Jobe Institute in Los Angeles, where he participated in the treatment of several professional athletes. During his time in LA, Dr. McVicker served as the assistant team physician for the Los Angeles Rams, Dodgers, Galaxy, LA Football Club, Los Angeles Sparks, Anaheim Ducks, and the Los Angeles Angels, as well as the USC football team. Since making the move to Florida, Dr. McVicker has served as the assistant team physician for the Miami Marlins, as well as the Jupiter Hammerheads, and the head team physician for the Jupiter Christian High School Eagles. So, Dr. McVicker, we're going to start things with basketball, and according to the Golden State Warriors, Hall of Fame-bound point guard Steph Curry reportedly suffered partial tears to his superior tibiofibular ligaments and interosseous membrane, as well as a lower leg contusion. So, Doctor, can you just break down these types of injuries and the treatment options available?
For sure. This is an interesting injury because it usually gets more attention as like a high ankle sprain. It happens lower in the leg. But this happened a little higher in his leg. So the two bones that connect the lower leg, the tibia and the fibula, are connected by several different ligaments in separate spots. So there's really strong ones at the ankle and then again at the knee where they connect. And so the point of these ligaments is to keep these moving as a unit. And so you can injure these ligaments with a rotational force, like spraining the ankle in certain rotations, whereas a laterally directed or separating of the two bones, that kind of force. Sometimes how you plant your leg and plant your ankle can direct some force through that ligaments in the ankle up through the interosseous membrane and then up towards the knee where he has the sprain. So, these can be acute or chronic depending on how the force is, and then, can affect anywhere from the ankle all the way up to just below the knee.
Doctor, what's the recovery time like for these types of injuries, and how quickly would an athlete be able to bounce back on the court or on the field?
So these are just like any other kind of sprain of a ligament. They can take, depending on the grade of the sprain, can take anywhere from a couple weeks to a few months, so long as they're not surgical, which appears that it is not. It just depends on how bad the force was on the ligaments and how much injury they actually sustained, but can usually generally around 6 weeks is a good ballpark.
Again, here with Dr. Zachary McVicker from the Paley Institute. Doctor, you've worked with numerous pro athletes. What are the most common hip and knee shoulder injuries you've seen? And, arthroscopically, how do you treat these types of ailments?
Yeah, so for the athlete, we'll just go, top down. So the shoulders, we're talking more about the shoulder labrum and, some rotator cuff injuries. But generally speaking, it's more of the labrum in the shoulder. And this affects many overhead athletes and anybody bringing any weight over their head, anything like that, and any kind of throwing motion or volleyball spiking or serving, anything like that. And then working down to the hip, the most common one is something called femoral acetabular impingement, or FAI, hip impingement, and labral tears. So this can affect anybody who's running, squatting deep, and it creates a lot of pain in the groin, which then it can limit some of the motion of the hip and then cause injuries to other places because you're compensating. So that's an important one. And then going down to the knee, we're talking about ACLs, any kind of ligament injuries, meniscus tears, things like that.
Doctor, I also read that you have extensive training in muscle-sparing anterior total hip replacements. Can you explain this option that you provide for the latest in hip care?
My practice, I do a lot of hip preservation with the hip arthroscopy, treating the impingement that we talked about, and a lot of dysplastic hips. So the anterior approach allows me to get people back to what they want to do a little quicker. So my patient population, if they're just too far gone for any kind of hip preservation surgery, generally my patients are a little younger who need a hip replacement. They're just too far gone. And so they're a younger, more active population. So I choose to do this approach because it gets them back very quick to what they want to do. There's no restrictions. And that's really why I like it. There's very, very little risk for dislocation or instability of the hip. And the positions that are unstable are not natural to get into, so they can get back to running marathons, hiking, doing whatever they want after they're all healed from the surgery.
Really amazing stuff to hear about as we chat with Dr. Zachary McVicker, a sports medicine physician and arthroscopic surgeon at the Paley Institute. So, doctor, another injury we hear about all the time is the hamstring injury, and not just in the professional ranks, but for the casual athlete and the weekend warrior. How do you go about treating hamstring injuries, especially when there are multiple grades and severity of injury?
Just depends on the location of the injury. So the muscle belly is the most common, so mid-thigh, and usually this is just treated with some rest and some PT and just gradually getting back to your activity, and can heal depending on the grade, anywhere from a couple weeks to a couple months. The ones that are more surgical that I treat are they're called proximal hamstring injuries. So it tears off of where it connects near your buttock. And these can happen from it. You think about like wakeboarders who get their hips are forced to flexion, and then their legs are still extended, and they kind of pop it off where it attaches to your pelvis. And so when that happens, you lose the force and stamina, and so you really start to feel the weakness in the hamstring. It can cause some nerve injury too. So we tend to repair those. We can do that minimally invasive as well. We do it through what's called endoscopic. So we do it through a camera and some small incisions and reattach it to the bone. If there are certain types, then we open, but generally we like to do it through a scope.
Doctor, why is it so vital to see a sports medicine physician like yourself versus trying to treat the injury alone or rely on online sources?
So there's a lot more that goes into treating an injury, especially in an athlete, than just doing a good job on the surgery. And there's a lot of factors that go into how well they're going to succeed. You want to know about rehab after. That's a big one. You need some good therapists to help you and work well with the surgeon. And then ultimately, where they're at mentally when they're ready to get back. I mean, that's a huge limiting factor for some players getting back. To trust that they're not going to get hurt. That trust their leg, trust their arm, whatever it is, to get back to playing at the highest level they possibly can. And you need someone along the way that can assist with that. And if you're struggling, knows how to treat it and get you over that hump.
Staying on the topic of mental health and making sure you're in a good place mentally while recovering from an injury, can you just talk more and elaborate again on the importance of optimal mental well-being during rehabilitation and recovery?
Yeah, sometimes you need some athletes need some sports psychology to trust things again, and anxiety and depression is getting a lot more media attention through some athletes who are brave enough to come out and speak about it. And that's a huge thing that affects not only athletes, but any patient undergoing a surgical procedure. Anxiety and depression can really lower your outcomes after surgery. So getting in a good headspace is really important for the best outcome possible. And then, nutrition and things like that are key to healing and making sure that everything is going the way that it should.
Wrapping things up with Dr. Zachary McVicker from the Paley Institute. Doctor, in the arena of minimally invasive arthroscopic surgery of the hip, the knee, the shoulder, and the elbow, what's new in terms of technologies or techniques that could improve or enhance care in this type of medicine?
I think a lot of the new innovations are biologics, meaning things like platelet-rich plasma, in the future stem cells, things like that are constantly having research and ways that we can heal our own body through some assistance with doctors as well. And the surgical procedures are always being changed with new technology, new techniques, and we're constantly doing research on that. So it's always changing, especially the arthroscopy cases. What we can actually stick a scope into and heal is ever changing and expanding.
Dr. McVicker, I got to let you go, but I sincerely appreciate the time. Thank you for all the awesome information, and I look forward to talking to you again soon.
All right, thank you.
Again, that was Dr. Zachary McVicker, MD, Sports Medicine from the Paley Orthopedic and Spine Institute. You can find Dr. McVicker on the main campus of the Paley Institute in West Palm Beach, which is on the St. Mary's campus. And Dr. McVicker also has clinics in Palm Beach Gardens, and there will soon be a location in Jupiter as well. To learn more about the Paley Institute, go to paleyinstitute.org. That is Paley, Paley, or call 561-844-5255.